Okay, hello everyone. Thank you for joining this training with Louise Ryan of the Administration for Community Living. Louise is going to be talking about ACL and other things that a new ombudsman ought to know. So at this point, I'm going to just turn it over to you. Louise, thank you for joining us today.
Thank you, Carol, and welcome to new state ombudsman. Can you go ahead to the first slide, Carol?
Yeah, I'm there.
Okay.
Is that the one you want?
The welcome slide, I don't see it on the screen. So today we're going to basically give you as a new state ombudsman, I'm going to provide an overview of the role of the Administration for Community Living, known as ACL, and the Administration on Aging. We'll talk about what the state ombudsman can expect from ACL and AOA, and also we'll have plenty of time for answers, question and answers. There we go. So I'm going to move on to the next slide and just talk about the mission of the Administration for Community Living. I came to ACL in 2011, and at that time it was just the Administration on Aging. And in 2012, the Administration for Community Living was formed to address and to meet the needs of both people who are aging, older adults, typically the Older Americans Act programs, merged with our Office on Disabilities and the Administration for Intellectual and Developmental Disabilities to really give us more of a coordinated approach to providing services to people. And so the mission of the Administration for Community Living is to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and their families and caregivers. And so on the next slide, you'll see that when we did this merger in 2012, that the agency grew. So, and also there were programs that came to us that are very complementary to what the Ombudsman program does. So, for example, within the Administration on Disabilities and the Administration on Intellectual and Developmental Disabilities, we have the DD councils, or the Developmental Disability Councils, the Protection and Advocacy Systems, and the Centers for Independent Living. So we, grew and added those types of programs which cross into your work as a long-term care ombudsman because, for example, the Protection and Advocacy has a role to support people with disabilities and advocate for them, including older adults and people who live in long-term care facilities. Likewise, the Centers for Independent Living have a mandate to help to transition people out of nursing homes. So there's some very natural opportunities for partnerships there. So the Administration for Community Living is part of Health and Human Services. We're called an operating division. And and you can see on the little map, we have 10 Health and Human Services regions, and we currently have 10 regional administrators, and they work to kind of coordinate with other Health and Human Services divisions at the regional level. So, for example, there's CMS, Centers for Medicare and Medicaid Services. They're at the regional level as well. SAMHSA, the Substance Abuse and Mental Health Administration. So we try to offer regional coordination. Next slide, please. The other thing that happened in 2014 was we added more programs, and in particular, what we call NIDLR, the National Institute on Disability and Independent Living Rehabilitation Research, which is focused on, as it says, research related to disability and independent living. So that was another program that came to us. Also the assistive technology programs. One of your local universities might have an assistive technology center, and that is quite likely in part funded by ACL. Next slide. So just quickly, our leadership, and I need to update this slide here, I just realized. So Lance Robertson is our administrator and assistant secretary for aging, and he came to ACL in August 2017. And then you'll see Edwin Walker is a very key leader to us because he is the director of the Office of Long-Term Care Ombudsman Programs. And I might add, we do have this position that says vacant is not vacant anymore. I thought I caught that. Tom Moran is the Deputy Administrator for Regional Operations and Partnership Development. We also have Julie Hawker, who heads up the Administration on Disabilities, and Mary Lazare, who serves with Lance as the Principal Deputy Administrator. So that's our key leadership. And Edwin Walker is the person you will likely see either if you come to the Consumer Voice Conference and some of the meetings before the conference that happen, the NASOP meeting, for instance, or other opportunities, he may be there. And then hopefully he will be at the spring training in Pittsburgh, at least for part of that time. Next slide. So I kind of alluded to that we have regional administrators in our 10 regions, and that came about in part because of the reorganization of ACL. So basically, the reorganization pretty much changed the usual structure of how AOA and ACL operated. We used to have staff out in the regions. They were called state liaisons, and they were all requested to move to Washington, D.C., and most of them did not. So many of them retired or, left their positions. So we have 10 regional administrators who serve as a focal point and a liaison within Health and Human Services and other federal agencies and out in their states that they cover, but they don't have as much time to provide the hands-on technical assistance that states or ombudsman programs may need. So we're still figuring out how to meet that need, and it is happening. It's just happening in a different way and more through our central office. So I would say as part of that reorganization, I am your kind of primary contact in terms of reaching out to when you have a question of AOA or the federal government in terms of the ombudsman world. I'm your kind of initial point of contact, and then from there, if I can't answer the question, I may go to my boss, Hillary, or to Edwin, or if it's a regional related issue, then I may also involve the regional administrator. So next slide. So what does the Administration on Aging do? I think many of you probably have a pretty good idea of that, but just as a reminder, so AOA is the agency that gives the grants to states and carries out the requirements of the Older Americans Act. If you look at the Older Americans Act, you'll see that it has a mission for the Administration on Aging, a directive, and then also it lays out the state agencies or state units on aging and the area agencies on aging. So AOA has a responsibility to help all that happen. We also are to serve as an effective and visible advocate for older individuals within the Department of Health and Human Services and with other federal agencies, and in terms of being active, in terms of, so for instance, commenting on proposed regulations and having policy discussions at the federal level. So that's part of our role. And then, of course, we through the Older Americans Act, which created and authorizes and funds the grants to states, we oversee that release of funds to the states for the state units on aging, who in turn have their methods to distribute funds to the area agencies on aging, and of course the funds for the Ombudsman program. The Title VII funds come through ACL. So basically, through the Older Americans Act, over all these years, which the Act was born in 1965, so basically it has created what we think of as the Aging Network. And of course, the Aging Network and the design of the Older Americans Act was to also leverage community engagement and state and local and other funds to complement the aging services that are developed under the Act. The other thing the Act requires is that states develop state plans on aging, 5-year plans, and you as the state ombudsman should have some opportunity to provide input into that, as in particular as it relates to the Ombudsman program, but in general in other areas where you see where it makes sense to provide advice or feedback, maybe for instance around the state's strategy to address abuse, neglect, and exploitation. That's a very common one where the state ombudsman would want to provide some guidance there. Next slide. So just as a reminder here, I have this little visual that kind of shows you how things work in a regulatory framework. So the Older Americans Act is our law, and from that law we have our regulation, and the Ombudsman program regulation is found in 45 CFR 1324. The 1321 is more specific to state units on aging. And so there's a little piece there that talks about the Ombudsman program in 1321, but most of the Ombudsman program, like 99%, is in 1324. We also have our Title VI program, which is our programs to Native Americans, Hawaiians, and Native Alaskans. And basically the services provided through Title VI pretty much mirrors what's the services offered in Title III, but it's got a focus on serving tribal elders. So after regulation, we have guidance. We used to do things called program instructions. We don't do those so much anymore, but there are some program instructions still on the ACL website. NORS is the data collection is an example of guidance because we have to get our data collection approved and all the instructions and all that approved. So it's a form of guidance. And then we have things like frequently asked questions or letters to states addressing specific questions that a state may have where they want an official response. So that's kind of how that works. Next slide. And a little bit more about the Older Americans Act funded programs. I'm not going to read the whole list to you, but the ones that you're probably most familiar with are, of course, Title VII. The Ombudsman program is Chapter 2. Chapter 3 covers elder abuse prevention, and Chapter 4 is around legal assistance development. So those are areas that, are of great interest to me. That's where most of my focus is, of course, on Ombudsman, but also in terms of how other programs support the Ombudsman program, I get involved. Now, Title III is also a source of funds. Excuse me. Title III is also a source of funds for the Ombudsman program through the area agencies on aging or through the state unit may offer Title III funds from the state level to support your program. The Title VI grants for Native Americans, we would like to do more to support Ombudsman programs to support tribal elders, whether it's, there's not that many long-term care facilities on reservations or tribal lands, but how do you support tribal elders who may be in an urban setting in a long-term care facility? That's an area we're trying to just beginning to explore some ways to figure out how to provide services to tribal elders and meet their specific cultural needs. Next slide. And I should add one other thing on the previous, oh, no, this slide works. Let's see, if you could go back, Carol, one more. Yeah, where it says, oh, next slide. There we go, where it says the Older Americans Act funds services to individuals age 60 plus. So we actually in the Ombudsman program, just making sure you are aware that when the Older Americans Act was reauthorized in 2016, it took away that 60 plus designation for residents. So our expectation is that the program serves long-term care facility residents of all ages, and most states did, but now it's very clear that states are to serve people regardless of their age who are in a long-term care facility. Here again is examples of Older Americans Act funded programs, which I'm sure you're familiar with, you know, nutrition services, in-home, services to tribes, as I've mentioned, and then, of course, elder rights. Next slide. A little more information on Title IIIB, and I'm not going to read this to you, but just be aware that there is, you know, this is the kind of depth of services provided through Older Americans Act programs, and of course that legal assistance one is really critical in terms of your state collaborating with 3B funded legal assistants who are often funded out of either they're at the Area Agency on Aging or the Area Agency on Aging provides funds to legal programs to serve older adults, and they can be really helpful when you have a resident who needs legal support in some way. So having memorandums of understanding and you know, guidance around how to refer to legal services is really important. Next slide. So as you know, we have the National Ombudsman Resource Center, and this is funded through the Administration for Community Living. It's a grant or a cooperative agreement that every three to 5 years is up for competition, and it has consistently gone to the Consumer Voice. So the Consumer Voice houses the Resource Center. The Resource Center is kind of a separate, they're housed, but they're separate from Consumer Voice. And the role of the Resource Center is to provide training, technical assistance, and information to state ombudsmen and representatives of the office and local entities and state units. They also work on analyzing laws, regulations, programs, and practices to help you understand kind of the changing trends that happen in long-term care services. And also they have done a lot of work to help with volunteer recruitment, volunteer management, by partnering with other organizations that specialize in volunteerism and have developed some really good training and tools around how to recruit and retain volunteers. Next slide. Okay, so how does this all relate to your work? So, as I've mentioned, we are the ones who issue the grants to states. The grants that go to the state units on aging and to your program are called formula grants or mandatory grants, whereas a grant to the Ombudsman Resource Center is called a discretionary grant because it comes up for competition every few years. It doesn't just automatically go out in the way that it does to the states. ACL reviews and approves the state 5-year plan on aging. We provide guidance and interpretation, technical assistance, and intervention. We have a lot of evaluation work that goes on, and I'll mention that a little in a few slides down the road. Also, we develop the framework and the guidance for NORS, the National Ombudsman Reporting System, and of course we fund the technical resource centers. And I might add that NORC is your primary resource center, but we also fund NCLR, the National Center for Law and Aging. We fund Adult Protective Services, Technical Resource Center, so a lot of other centers that are relevant to your work. One on dementia, for instance, so there's a lot of good resource centers. I could go on with the list. There's so many and they're really good, and we try to encourage the resource centers to collaborate as appropriate. So you'll see often that NORC might be offering a webinar, say, with NCLR, the National Center for Law and Elder Rights, for example. Next slide. So as I mentioned before around guidance and interpretation, I would suggest that you really get to know the Older Americans Act, and in particular, Section 712, which is where the Ombudsman program language is at. And, it seems like every day I look at it, and also our regulation. And so the regulation really spells out, again, it gives you've got your foundation of the law, and then the regulation kind of fills in those. If you're thinking of a house, it fills in the walls and, the windows and provides the more of the structure. So I suggest that you really read that regulation and get to know it. We also have frequently asked questions that have come up, and there's a link there to that, frequently asked questions about the regulation. Of course, we have NORS, and as you know, NORS has just recently changed, and I'm hoping that you all are aware of that, and I've looked at the resources on the Ombudsman Resource Center website. The other thing we do in terms of guidance is we provide letters to states, and those don't happen that often, but I kind of keep a library of them, and they're very helpful when a state has a question. Maybe it's about fiscal or conflict of interest or something that's kind of meaty and kind of tricky. We will, those are issues that it's sometimes better to have a conversation if you've got some complicated thing going on in your state. For example, let's see, a state law passed that says you have to participate in healthcare decision making. This is kind of a true story. And that doesn't make sense for the program to be a decision maker for residents, right? So how does ACL help? How can we help? So, we can write letters. We can't get too deep in the weeds on state law when the state needs to work out their problems, but we can give, here's our interpretation of the Older Americans Act, here's our interpretation of the rule, here's what it means in practice for the Ombudsman program. So if you have sticky issues that come up, I'd say it's a good idea to pick up the phone and call me and talk about it, and we can figure out next steps. And once we figure out, you want to figure out what's the right question to ask if you need some really in-depth technical assistance. So it's always good to have phone calls if you're kind of not sure if you're in a tricky spot with an issue going on in your state. Next slide. Okay, and I've mentioned this already, so let's go on to the next slide. And Center for Regional Operations, I've mentioned that as part of our reorganization. So as time goes on, we'll find opportunities for you to meet who your regional administrator is. And also on our ACL website, you can look up under leadership and find out who they are, and I can certainly let you know if you want to know who it is. Next slide. So what about this Office of Long-Term Care Ombudsman programs here at AOA? So we are, the Office of Long-Term Care Ombudsman programs is housed within the Administration on Aging, and within that, it's within the Office of Elder Justice and Adult Protective Services. So we have like a hub of everything related to elder rights, elder abuse prevention in one office. That includes legal for our 3B funded legal services, legal assistance developer. So we're a little hub. Edwin Walker serves as the director of the Office of Long-Term Care Ombudsman Programs. And Hillary Dolan is my direct supervisor, and she's the director of the Office of Elder Justice and APS. And then there's me, I'm the Ombudsman Program Specialist. So I will say we work really closely together. Hillary is a lawyer and years ago worked as legal counsel for an ombudsman program. So she really values the connection and wants to strengthen programs in terms of their coordination with legal services. That's a big interest to her, especially when you look at the helpfulness of having legal services for residents and legal counsel for ombudsman programs around whether it's involuntary admission, transfer and discharge, or trying to address a systemic issue where you need some guidance from an attorney. So she really wants to support that aspect, whether it's and more looking at the 3B funded attorneys and that support for residents, but beyond that as well in terms of, do you have adequate legal counsel? So that's a special interest to her. Edwin has been with ACL AOA since the mid-90s, and he is a career executive within the federal government. And I came to ACL or AOA back in 2011, and I came from Washington State, where I'd been the long-term care ombudsman there. So we have a lot of years of experience together. Next slide. And some of the things we do, again, I think I've hoped you get the sense that we help to support your program operations. For instance, the big project we had earlier was after the regulation was final, and we worked with all the states, and that was with our state liaisons as well, to help help states determine what they needed to do to come into compliance with the rule. So that was a big lift that we did, and we're still monitoring that and still following up with states in terms of areas that maybe still need attention around regulatory compliance. I'm the programmatic lead for NORS, so in terms of the whole redesign of NORS that just happened, and when you submit your reports, I give the final certification. We just redesigned the reporting software, the OEP, so I was heavily involved in that. I'm also the project officer for the Ombudsman Resource Center. The other thing I think that we do is we do weigh in on, when I'm talking about we, the royal we do really get involved in within our sister divisions like CMS or other federal HHS divisions. When there's proposed regulations, there's several of us at ACL, depending on the content, will give comment and try to give that either the resident perspective or the person-centered perspective on proposed regulations. So that's something that we do behind the scenes that people often aren't aware of. Okay, next slide. So as I mentioned, in terms of NORS, I do a lot of work with another group within ACL called the Office of Performance and Evaluation, and they're kind of in charge of data and program evaluation. So when I did all the work on NORS and the OEPs, the software, I was working very closely with our contractors and also with our ACL Office of Performance and Evaluation. So, and I think you all know that the new NORS went into effect October 1st, and we've done lots of training on that. There's the link to all of the training you may want on that topic. Next slide. But we also are doing other work with the Office of Performance and Evaluation. So for instance, we've had a long ongoing Ombudsman program evaluation study. So we started off having a design, kind of how should we evaluate Ombudsman programs, what should we look at. We developed logic models. We're just finishing up with what we call a process evaluation. So pretty soon a lot of reports will be coming out that look at different parts of the Ombudsman program and what do Ombudsmen have to say about the program. So state ombudsmen were interviewed, federal stakeholders were interviewed, volunteers, there was a big sampling of volunteers who answered a survey, as well as what we call lead ombudsman, what you might think of as your regional ombudsman, and then ombudsman staff. So we collected a lot of data from those groups and have a lot of really good reports on the verge of coming out, and we'll be announcing them and having them on the ACL website and the NORC website. Our next step is to have what we call an outcomes evaluation to really try to get more at how do we measure. You know, we've done the design, we've kind of got the lay of the land of ombudsman programs, and then we have to look at, well, what are they really doing? How do we know they're working? So we will be doing things like focus groups with residents, more surveys of ombudsmen, surveys of facility staff, and so this will be done through our contractor, which, to make things confusing, is also called NORC, but they are NORC at University of Chicago. So I work with two NORCs. Who would have thought? Another project we're working on is a small study to look at promising practices in providing ombudsman services to tribal elders. And we're looking at the state of Arizona and their specialized program there, where one of their AAAs is a coalition of tribes, and they have ombudsman, local representatives of the state office who serve tribal members. And then the other thing we are doing is, what we've done is on AGID, which just changed its name to the, Aging, Independence, and Disability Program Data. I still can't remember what the whole AGID stands for, but it now stands for Aging, Independence, and Disability. I know that. It's the ACL kind of all things data website. So we have we have data stories on there, You can take a look at those under resources. It can give you some ideas as to how to present your state's data. And, we're trying to build that out some more. And we recently did a webinar on AGID and how to use it. And I need to get that to NORC, the Ombudsman Resource Center, to post if you'd like to learn more about that. So stay tuned. Next slide. So just a couple other things in terms of some of our current activities. We do have an Elder Justice Coordinating Council meeting that is coming up in December. It's on December 3rd. And you are welcome to listen to that through webinar. I mean, it is a public meeting if you happen to be in Washington, D.C. And I would recommend that you go to the ACL website and sign up for the listserv so that you get general announcements about what's happening at ACL. So that announcement will be coming out very soon. Also, the Resource Center, I'm sure, will share it as well, but that's something that is coming up of note. I've also mentioned our interest in supporting legal assistance to coordinate with ombudsman programs. That'll be a continued focus. A few other things we do. We are coordinating with our protection and advocacy systems here at ACL, trying to look at how we can support collaboration of both Ombudsman and P&A or disability rights programs. We do a lot of work with CMS, and again, some of this is more behind the scenes, but we have regular meetings with CMS central office on a variety of issues, whether it's nursing home, home and community-based services. Kind of one of our focuses now is how do states address critical incidents in home and community-based settings. So there's a focus going on there. Also, we have coordination and collaboration with the Department of Justice, and they have elder justice task forces in all states. And depending on your state, you may have 2 or more Department of Justice districts, U.S. federal districts. So if you'd like the contact information for your lead for the Elder Justice Task Force, just email me and I can send that to you. Next slide. Okay, before we move on, I'm just going to take a quick break to see if there are any questions. I don't.
So far none have come in, but just a reminder, if you guys want to ask something, just type it into the chat box and be sure, well, just type it into the chat box.
Yep. Thanks, Carol. So in terms of the next slide, the Ombudsman Program Rule, you can see here's kind of the list, the summary of what's in the rule. And again, I strongly encourage you to read this and even to print it out and have even a printed copy handy. Couple areas that are very, really lay out a lot of nuts and bolts under the establishment of the office. That is where it lays out all the areas that you need to have policies and procedures. The functions and responsibilities really describes what the state ombudsman is supposed to do. And again, you've got a huge job. But if you ever think, well, is that something I should be doing? I think that's a good foundation for you to look at. And then what is the state agency supposed to do? I mean, they technically are the grantee from ACL. The state unit may choose to house the program in the state unit. They may choose to contract it out. But what is their responsibilities? So for instance, they have a responsibility to assure that you have adequate legal counsel, or to, make sure that there is what do you call it, with willful interference, if there's willful interference, that there is, that is addressed and that there's some sanctions around willful interference. So how does that work in your state, for instance? Of course, the duties of the representative of the office is where you're going to find all the information on complaint handling. And that is very, very critical to really get to know what that says. And I think for most of you, you've got policies and procedures now that have probably been revised, but you know, it's always good to compare what do your P&Ps say and how does it line up with the rule. We've tried to really look those over and make sure that they're in good order, but with 52 states, territory, and DC, that's a lot of P&Ps to look at. Conflicts of interest, again, there's both, it describes both individual and organizational. And again, if you connect things back up to the establishment of the office, you have to have policies and procedures that address conflicts of interest as it relates to either avoiding, remedying, or removing conflicts of interest. Next slide.
Louise, you mentioned several minutes ago that one of the things that you did after, or that ACL did after the 2016 rule went into effect, was that you worked with each state to have them make sure that they were compliant. If a new state ombudsman comes in and has not seen that report, how would they go about getting a copy of what the communication has been back and forth?
Yeah, so what we did was we put it on an Excel spreadsheet. So thanks, Carol, that was a helpful question. So if you inherited the computer and all the documents of the previous state ombudsman, hopefully you've come across somewhere an Excel spreadsheet, and there's probably more than one version because we asked for states to give their response on that spreadsheet, and then we've had back and forth on that. Some people converted it to a PDF or a Word, so it may not be an Excel spreadsheet. But if you just can't find anything about an ACL assessment of the program, just email me. I have all the documents, and I can share that. And what we did was we just kind of lined up the rule, and then where we found something that looked, maybe that isn't quite on the mark, we would identify that and ask for it to be corrected. A lot of times things could be corrected through revising policies and procedures. Sometimes it did require a regulatory or statutory change at the state level. So it kind of depended. Yeah. Next question, or next slide. And why do we have this rule? Well, I think because over the years, state ombudsmen reported frequent challenges. You know, there was real challenge in being able to fulfill their role as required by the Older Americans Act. In particular, being able to perform, you know, system-level policy advocacy, speaking to the media, kind of being that, you know, independent, autonomous voice for residents. Sometimes there was challenges being full-time, challenges saying, yes, I do designate these individuals or entities to represent the office of the ombudsman. Access to legal counsel was challenging. So not that everything's perfect, but we think and we've heard that the rule has addressed many of these issues and has really improved the effectiveness of the program. I can think of an example where a state for years and years, the state ombudsman could not speak to legislators, could not speak to the media, or, you know, be a visible advocate, and now that has changed, you know, like completely, where the state ombudsman is being encouraged to go talk to legislators, and so very different, you know, and because of the rule and the work that was done to help the state come to understand the requirements, it's made a difference. Next slide. So NORS, National Ombudsman Reporting System. So we've had a lot of training on NORS, and also we have one more training coming up in December 3rd, on how to get your NORS report into the Ombudsman reporting tool. And even though we've changed NORS somewhat, this basically there wasn't dramatic change. So we still have complaints. We still want to know the resolution of those complaints. We're still collecting information on activities. We're collecting narratives. The conflicts of interest is still fairly new. We ask states to report on organizational conflicts of interest. So if your, say, state office of ombudsman is located in the state unit, and the state unit also provides Medicaid services and case management and APS and a whole bunch of other things that are considered an organizational conflict, how are those remedied? So some things can be remedied where, you have firewalls and, you don't share information, everything's separate. And then there's some conflicts that cannot be remedied, like if you are housed within the licensing and certification agency, that will not work. Something has to give there. That can't, you can't have both programs. That's prohibited. If you look at the Older Americans Act, you'll see that it's prohibited. So sometimes there is no remedy. The program has to be moved, for instance. So if you have questions about conflicts of interest, I'd be happy to follow up with you. There's, again, good materials on the Ombudsman Resource Center website around both individual and organizational conflicts of interest. And if you have questions about the NORS reporting, if you think that things are the same, you've done your review, there's been no changes from the previous year, you can say that, or you can copy and paste what was in the previous year. But as a new state ombudsman, I encourage you to look at your organizational conflicts of interest with fresh eyes, especially as you look at your local ombudsman entities, and kind of take a good look at that and make sure that there are systems in place for you that any conflicts are identified and the remedies are described, and that's what you report in NORS, what was identified and the remedies. Next slide. So I guess what should you expect from us at ACL? So, we want to be there to help you to do your job as a problem solver for residents. We're there to, of course, provide technical assistance, whether it's around NORS or fiscal questions or interpretation of the Older Americans Act or the Ombudsman regulations. We are there to represent the program at the federal level, both within Health and Human Services and other federal agencies. Also, in terms of we try to share your data in ways that we can, occasionally by direct communication with the media or by promoting our own materials that describe the Ombudsman program and the problems experienced by residents and the great work that you do. So, we do want to represent the interests of residents to other federal agencies, and so we enjoy hearing from you, whether it's through email, phone calls, at conferences, and hearing what's going on, and of course through NORS. So keep us informed in whatever way works for you. And I think we're on to the last slide, which is one I really like. The Arthur Fleming, the Commissioner on Aging, back in 1976, he designed the Ombudsman program. And so he had this idea that, if you pass all these great laws and do investigations, but if they're not being applied to the individual, they might not just have been passed or issued. And so he had this idea of the Ombudsman program, and in particular a volunteer model, where you really get to this idea of neighbors in the community visiting their neighbors who live in long-term care facilities. So he kind of came up with the idea, basing it on the Swedish Ombudsman model, and here we are today, all these years later. So thank you, and I don't know if there's any questions, but I'd be happy to answer any.
No one has typed any in, so I'm assuming that everyone is just taking in all the information that you shared, Louise. It's an amazing partnership that the states have with the federal government, and NORC is very pleased to be kind of that conduit sometimes. So I want to thank you for taking the time to talk about ACL and AOA, the Older Americans Act, the law, the rules, and just the relationship. And so we will conclude today's webinar and look forward to more conversations in the future.
Oh, thanks, Carol. Actually, I wanted to say one more thing that I usually say and almost forgot, and that is that there's really, whether you contact the Resource Center or contact me or you contact your regional administrator, we all work closely together. So don't hesitate to reach out to any one of us, and certainly you can have private conversations with the Resource Center that don't have to go anywhere but between you two. And that is certainly, you know, they're a great sounding board for you. So, you know, again, just I would say don't hesitate to reach out. It's a big job, and you can't do it alone, and you need those sounding boards. So we're all there for you. So thank you.
Thank you. Goodbye, everyone.
Okay, bye-bye.